All right, welcome everybody. My name is Jonny Hartwell from 94.5 3WS. Welcome to our Pittsburgh Sleep Seminar. Full confession, I have a sleep disorder. It's called a morning radio show. I don't know if any of you guys suffer from the same ailment as I do, but at 2:30 in the morning, I get awakened suddenly. But it's kind of, Dr. Halil, do you have any recommendations on, do you have a cure for AM show, morning show itis thing?
Unfortunately not.
No, there's no cure. Maybe a psychologist. You're not. So anyway, when we get started, how many of you have a spouse that has a sleep condition or has sleep apnea? Just raise your hand, a few. Okay. The rest of you, I assume, have sleep apnea or here for the free food. Both, okay. I got to thank Cook Goose Catering. They just gave me the menu: beef and gravy, chicken Italiano, green beans, and redskin potatoes. So we will feed you afterwards. So again, thank you for coming here. There's three things I want to make, points I want to make up front. First of all, if you think you have sleep apnea, I highly recommend that you seek treatment as quickly as possible, because we're going to be talking about the ramifications of sleep apnea. And I'm not a doctor. I'm just a disc jockey. I'm barely a disc jockey at that. So seek a physician's advice. Second of all, results may vary on some of the things that we talk about, and like I said, I'm not a doctor. I'm just a disc jockey, so I'll be asking some of the questions. But we do have a doctor on stage, Dr. Halil from the Allegheny Health Network. Welcome.
Thank you.
So I think a lot of people here obviously know what sleep apnea is, but for the people listening, can you describe what the condition is?
Yes, sleep apnea is a fairly common condition, a sleep disorder, which is characterized by essentially a collapse of the throat when the patient is sleeping. So obviously when the throat collapses, this decreases the breathing ability and decreases oxygen supply to the brain. And as a result, the brain wakes you up so you can take another breath. And then you breathe while your sleep level has become shallower, and until you become asleep deeper, and then your throat collapses again, and it's a cyclical thing. So it's a cycle of throat collapse and waking up, and throat collapse and waking up. And this is why patients with sleep apnea have a very fragmented, rather shallow sleep. And this is why they wake up still tired, they're not refreshed from their night's sleep, and this is why the sleep apnea itself has the repercussions of
so normally, like when somebody's awake, the muscles are tense and tight, but when they're sleeping, it relaxes, and you basically are suffocating yourself at night.
That's essentially true.
So what are the what's the first, when you go see a doctor, what is the procedure of diagnosing sleep apnea?
Well, first of all, the doctor will have to take a good history to find out what exactly is going on, what are the symptoms, is this patient generally having the hallmarks of sleep apnea, of daytime somnolence. People with sleep apnea typically tend to doze off and fall asleep at the drop of a hat. They fall asleep when they're waiting at the red light, and they fall asleep if they're watching TV or sitting down, etc. Many of you would know that.
Do I show of hands? People that experience that, the drowsiness at work, driving. Is there anybody who drives for work? That's just. And if somebody has sleep apnea, I kind of mentioned that there are ramifications. For example, the heart conditions and diabetes. What are some other things that?
Let me just finish the issue of the evaluation. When you go to see a doctor,
right?
The first thing after the history is taken is to examine the anatomy of the throat. The breathing happens through the nose and the mouth and then down into the throat and into the lungs. Many of these areas can produce obstruction. I mean, somebody who has an obstructed nose would be liable to have problems with sleep apnea. Somebody who has huge tonsils can obstruct their throat a lot easier than somebody who doesn't. Somebody who has a lot of fat around their neck, that tends to crowd the throat by the fat crowding the throat inwards. So the doctor will do an examination. Typically, the examination will have to include a thorough evaluation of the upper airway as to what the shape of the upper airway is, and if there are factors that are going to cause this upper airway to obstruct or collapse.
When you said somebody who is heavy, if they lose weight, that doesn't necessarily solve but it may.
It may, but it is not always the case. Not everybody who has sleep apnea is obese.
Mm-hmm.
Many of the people who are obese will tend to have sleep apnea, but not everybody who has sleep apnea is obese.
And you'll see a lot of athletes who have sleep apnea.
Yes. I mean, you see a lot of people who have sleep apnea that have a normal body habitus.
Mm-hmm. Okay. So what are some of the ramifications, the other health ramifications when you have sleep apnea?
Surprisingly, these are fairly severe and fairly common with people with sleep apnea. The more frequent ones include a significant rise in the blood pressure, a condition called pulmonary hypertension, which is a fairly significant disorder of the lungs and of oxygenation through the lungs. That puts a lot of strain on the heart. You can get into heart problems, which would include arrhythmias and heart failure, heart attacks. You can have stroke, and a lot of these have to do with decreased oxygen levels in the blood.
So while you're sleeping, you're depriving your body of oxygen. That makes the heart race even faster, and that creates all sorts of problems?
Well, yeah, you're depriving your body of oxygen, which is, of course, essential for the proper function of a lot of organs. And your heart will have to pump faster and more frequently. And
now, we have a few people who have signed up who have not seen a doctor yet. What are the ramifications of not doing anything?
These conditions will evolve, and they'll become more and more and more severe, and it's very insidious. These conditions they don't hit you just like that, but they will creep up on you little by little over a period of time. And then you can, a lot of people who have had strokes, like 80% of people who have had strokes have had sleep apnea. So, they say somebody has had a stroke, but if you probe carefully and deeply into their history, you'll find that many of these people have had sleep apnea.
And usually,
undiagnosed.
At what age generally do people kind of realize that they may have sleep apnea? Is it?
So sleep apnea can occur in children.
Wow. Okay.
We see that a lot in children, and especially in children, the main cause is either these kids with huge tonsils and adenoids, and they actually obstruct their breathing, plus or minus obesity in children.
Now, we're going to get and describe Inspire here in just a second, but other than Inspire, what other means of treatment do people use to treat sleep apnea?
The standard of treatment for sleep apnea is what's called the CPAP. It's the continuous positive airway pressure.
How many of you guys use? Quite a few.
Yeah, essentially, it's a mask that pumps air through your airway under pressure, and that overcomes the collapse of the airway. This is the standard of treatment, and in many people this works fine, and it works well. And many people are happy with it, and they can't live without it, and they take it with them wherever they travel, wherever they go. and they are inseparable. But also there are people who cannot tolerate it, who are averse to having something on their face, on their mouth. They can't sleep with it. It bothers them either right away or over time. And they can't get used to it, and it becomes itself a problem.
Is it something that is difficult to get used to?
It depends on the individuals. You know, I find that most of the time, people who, let's say, have an obstructed nose will have a difficulty tolerating the CPAP because the airway is not patent and it's cumbersome to try to push air through an obstructed nose. But generally, people who have, let's say, a normal airway, many of them get used to the CPAP and they work well, especially that the CPAP reverses the sleep apnea and makes them feel a lot better. And, you know, they sleep better, they feel better when they wake up in the morning, they can go on with their life. You know, and these people get into a cycle of more sleepiness, more tiredness, they'll do less, they exercise less, they become more obese, they become more sleep apnea. So it's a vicious circle.
Gotcha.
It's worse.
Okay. What about dental devices? Is that something that?
Yeah, dental device is the second, I'd say, second thing on the list of treatments for sleep apnea. It's a device that works. Essentially, it clips onto the teeth just like a denture, and it pushes the lower jaw forward. So it brings the jaw forward and opens up the airway, so it decreases the chance of the throat collapsing during sleep.
What are some problems that occur with CPAP or the dental devices?
Well, there are no problems with the CPAP except that people find it cumbersome and difficult to tolerate. With the dental device, on the other hand, it's sort of a bit awkward in that it pushes your jaw forward and it keeps your jaw in a forward position. And in some people, this can cause some discomfort in the jaw and the joints. Some people like it, many people don't.
Okay. We're going to bring in David Edelstein. He's actually had the Inspire device implanted. Before we get your story as far as Inspire is concerned, tell us your experience as far as CPAP.
Okay. Probably started using CPAP around 2012. My cardiologist, I was already having issues with AFib and flutter arrhythmias and everything, and he was going through his whole diagnostics and everything.
Well, let's go back. When did you have first experience sleep problems? Did you inquire what doctors call ETTR? You know what, doctor? You know what ETTR is?
No.
Does anybody know what ETTR is? Elbow to the ribs.
Oh, yes. Well, the doctor turned to my wife and said, "Does he snore?" And I said, "Absolutely not. I don't snore. What are you guys talking about?" She nodded her head.
Okay.
Yes. Then the bell went off, and he said, "Sleep study."
Okay, tell us what happens during the sleep study.
That's weird. I've done a number of sleep studies. My first one was at the hospital up in Beaver County, and they wire you up and everything, and they have cameras, and you're in a bed, like at a little hotel room, and they monitor you. You try to get to sleep, not the easiest thing, and they see how you're breathing, and if you are having episodes of awakening and all that stuff. And halfway through, they came and said, "Here, put this mask on. We already know you have sleep apnea." I was severe. They diagnosed me. I was waking up 43 times an hour. So the doctor said, "You got to use a CPAP." So I used it for 3 years. And for 3 years, it was okay. We traveled all over the world. We took it. It was my buddy. But then somewhere in that third year, I couldn't use it anymore. I was becoming very claustrophobic. I actually at times had got up in the middle of the night and threw it across the room because I was just feeling like I was suffocating. The mask wasn't fitting as well. You know, there were leakages. I was just very, very uncomfortable.
Is there anybody that can relate to those kind of stories? Well, look at all the hands. Okay, yeah.
So I actually stopped using it. I went back to, I didn't use anything for a little while, all right? And I was driving down the highway, this is a God story, to Ohio, and I was listening to, they were interviewing a doctor here who was on the early studies. I almost drove off the road. It's the first I heard about Inspire. It just got approved. I said, I'm calling him. So I called, went in, and we determined that we're going to try different masks. That didn't work. Go to the dental appliance guy. That didn't work. Then Inspire. But let me tell you what my mornings were like before Inspire. I would wake up. My head was aching. I had a headache every morning.
Anybody experience headaches, migraines? Yeah.
I was in a fog. I mean, a mental fog. And I didn't dream anymore either, because you're not getting into that deep REM sleep anymore, you know? And it was a very superficial. I could remember watching the clock, 1:30, 3 o'clock, 4 o'clock, 5 o'clock in the morning. It was just continually up, and I was just exhausted. If I had to drive to Michigan and Detroit, I had to stop twice or 3 times on the road. So life wasn't fun. And wearing a CPAP, you know, my poor wife had to put up with it for 3 years because I turned the wrong way and all this blast of air would come about her. And but it worked for a while, and it really worked. But when it failed me, and then I was not a good candidate for dental appliance, I mean, I was really struggling because my heart arrhythmias were getting worse and worse and worse. And I had to go see a specialist downtown at AGH, and I had a total of 4 heart ablations done. I was a hard case for them, and a pacemaker put in, all in 2 years.
So you have had other health ramifications.
Absolutely, and the arrhythmias are scary when you're starting to get irregular heartbeats and uncontrollable. And the meds were, you know, they tried different types of meds and everything. And at Allegheny General, they said, if you don't fix the sleep apnea, I can't help you any further because your arrhythmias and everything are just going to continue.
All right, so let's take a break.
Sure.
And hang on, Stan. We're gonna show a quick video from CBS News that talks about Inspire. Then we'll start taking your questions. Okay. So you can take a look at the monitors.
In our morning rounds, a treatment offering hope for millions of sleep apnea patients. The disorder causes people to stop breathing when they're asleep. An estimated 22 million Americans suffer from sleep apnea. It puts them at greater risk for diabetes, heart disease, stroke, and memory loss. Patients who are older, overweight, and male are generally most at risk. David Begnaud shows us the new option helping some patients. David, good morning.
Nora, good morning. For those who struggle with sleep apnea, treatments like the CPAP machine can be hard to sleep with. They don't always work, and a lot of people just can't get a full night's sleep with it. But now there's a new FDA-approved device called Inspire, and it's gaining popularity. For some people, it's a last resort. Their life literally depends on it. The Cleveland Clinic named this kind of treatment #2 on its list of top medical innovations for 2018. We met a woman who finally found relief after more than 2 decades of trying to get a good night's rest.
I wasn't breathing. I wasn't getting the correct amount of oxygen. My thought process had gone.
Good job!
Peggy Sarabo's memory got so bad, her family thought she had dementia.
Yeah.
The 59-year-old was so exhausted, she says she could barely do her job as a nurse.
So people were noticing it, but you were too.
I was too.
You knew something wasn't right.
I knew, not as quickly as they did, but I knew I was in trouble.
Peggy has severe obstructive sleep apnea, where her throat muscles relax, blocking her airway and disrupting her sleep. On average, she stops breathing 53 times an hour. That's nearly once every minute during a night's sleep.
Give me an example of a night.
Up 4 hours, maybe sleep 2. This is the area where I would sleep.
Oxygen machine,
Correct.
CPAP.
Correct.
She tried other
Close it.
treatments.
Take the mask, bring it over my face like this.
She did not find relief from the CPAP machine, a common treatment that delivers constant pressurized air.
The CPAP wasn't getting the job done, so you needed
Exactly.
oxygen on top of that.
Exactly. And then that didn't work. That's when they introduced me to Inspire and saved my life.
Inspire is a pacemaker-like device implanted in the chest. It senses when your breathing slows down and sends an electric pulse to the tongue to stimulate it forward, keeping the airway open.
This has been revolutionary. It's been a game changer.
Dr. Maurits Boone is Peggy's doctor at Thomas Jefferson Memorial Hospital in Philadelphia.
She'd given up. She had memory issues. She was miserable. This is not a benign disease. As I said, this is a killer, and it actually shortens people's lives.
I didn't realize I had it so bad.
A few months after having the Inspire device implanted,
You just need to relax and breathe normally.
Peggy went to a sleep lab to see how it was working.
Right, so listen for me on the intercom, okay? Okay, great. Good night.
They ran tests throughout the night, and early the next morning, Dr. Boone revealed the results.
So before we activated the device, we have all sorts of problems. This is basically your brain saying, I'm not breathing, I need to do something about it. And after we activate the device, it's perfect. Look at your oxygen. Nice, stable, flat line, staying around 96, 97%. So this is good as it gets.
Okay.
And as far as I'm concerned, this is a cure. This is awesome.
A study in the New England Journal of Medicine found that more than 2/3 of patients experience less sleep apnea after getting the implant.
It was like sleeping with a herd of elephants.
For years, all Peggy and her husband David wanted was a good night's rest. And now they're finally getting it.
I'm going to show you.
Every night, Peggy turns on the implant right before going to sleep.
What's it like to sleep now?
Great. Turn myself on. I go to sleep. And I sleep. And then I get up and I turn myself off. And I have a normal day like you and everybody else.
Come here, Max. Come here, Doodles.
It doesn't work for everybody, but man, it worked for you.
It sure did. It saved my life.
The ball.
Let it go.
Now, Inspire is not for everyone. It's only for moderate to severe cases like Peggy, and like any surgery, there is a risk of infection. For Peggy, she says her memory is back to 100%, and she's sleeping great at night.
And is insurance covering?
So insurance, it's a case-by-case basis. Her doctor had to kind of nudge the insurance company along, but they do.
Well, she must really love her husband after saying on national TV, it sounds like a herd of elephants.
They're sleeping together.
Yeah, that is really great news.
So does she
Good
have to
for your
wear the
marriage, too.
mask when she's got the implant?
No, not anymore. Not anymore.
Wow.
And when she turns it on, she feels nothing. She can just feel it pulsating her tongue forward.
It's like a life-saving device.
Oh, it is.
Yeah.
Absolutely.
That's
Great.
All right, Dr. Halil, is Peggy's story typical?
It certainly is. These are people who go for the Inspire procedure. Obviously, they have tried other things before. They've tried different methods, and when things don't work, the Inspire really, what you heard is exactly what happens. It's a game changer for people. It has changed their life. It changes their outlook. It changes their way of sleep. It changes the way they feel, and it's. The nice thing about Inspire is it is fairly physiologic. It's not an extraneous, it's something that works with your body, the way your body is functioning. It senses your breathing through a sensor in the chest. And with the battery, it leads to the electrode in the tongue, in the back of the tongue. And that electrode, because of the breathing, will cause the tongue to be pushed forward. So every time you're breathing, your tongue gets moved forward, and that opens up your airway.
All right,
it's
Dave.
only implanted on one side,
Yeah.
and it's not obtrusive. I mean, it's not painful, or people barely feel it, and it works sort of quietly with your body in the process of sleep, prevents your throat from collapsing.
All right, David, is it a game changer?
Changed my life.
All right, very good. All right, let's take a break. We'll be back in just a minute. Okay, so very quickly, the procedure of implanting the device, how invasive is it?
Well, let me tell you one thing first. Before we actually decide to implant the device, patients go through an evaluation, which includes a sleep endoscopy. patients are put to sleep in the operating room, and they're asleep but breathing. And we watch them breathe and snore until their throat collapses. And we have to take a good look at that area of collapse and to see if it is the proper configuration of the throat. Not everybody is a candidate for the Inspire procedure.
It's FDA approved, correct?
It is FDA approved, but if you don't have the proper configuration of the throat for the Inspire procedure, it will not work.
Okay.
So you have to have the proper configuration of the throat, the proper pattern of collapse for the Inspire to work. And if it does, if you're the proper candidate, then it's perfect.
You said it's a game changer, David. You told us about your story with the CPAP and discarding it and having the health ramifications. Tell us the process that made you consider Inspire.
The process was pretty straightforward to me. The CPAP was not working. I was not a candidate for dental appliance. Any dramatic surgery was not even going to be considered. Inspire was my last chance, in reality. And I took in consideration, yes, it is a surgery. Have to go through an endoscopy and all that stuff, and I did. And so for me, it was a pretty short process, of evaluating and knowing, because I know one thing: if I didn't correct the sleep apnea, my health would continue to deteriorate. It's a great motivator.
And then the procedure, where is it placed?
First of all, we put an electrode on the nerve of the tongue. And placing the electrode is fairly critical because the nerve of the tongue has branches, and these branches go to different muscles within the tongue. Some of the muscles of the tongue will move the tongue backwards, and some of these nerves go to some of these branches go to the muscles that move the tongue forward. So it's critical to isolate those branches that go to the muscles that move the tongue forward.
So one is connected to the tongue, and then there's another.
Yeah, so we put the electrode here, and then there's a battery, just like a pacemaker battery that's implanted in
David's showing that's how small it is.
in the upper chest here.
On the right-hand side.
On the right-hand side. And then there's a sensor that's placed between the ribs, and that senses the breathing. With the battery here, it gives you the stimulation to the electrode on the tongue, and it moves the tongue forward.
Now, David, I think everybody wants to know, what does it feel like when you use it?
Well, when you go to activate it, all I do is I put this device over here and I turn it on, and what it does, it moves the tongue forward once. And at the very beginning...
Can you feel it?
Yes, you can. You could actually feel the tongue moving just gently forward, okay? Now, the good news is I'm programmed for about 25 minutes. So I have 25 minutes to fall asleep, which I usually do. And then it just gently moves the tongue while I'm asleep. I don't feel a thing. Okay. Now, if I happen to wake up in the middle of the night, which I don't do too often anymore, I can put this on a pause while I go to the bathroom or something, and then go back to bed and put it back on, and that's like a 10-minute pause and go right back to sleep. But even if I'm awake and I can feel the tongue, so if I try to talk, I would be lisping a little bit, but it's nothing outrageous. It's just this kind of the sensation of the tongue gently moving forward. And what it's doing, it's allowing me to breathe and have a clear airway.
Is there an adjustment period? Is there a period of transition?
Yeah, I mean, the first, once they activate you, it's for like 30 days. You go home and you start to work with the different levels of intensity, I'll call it. And then, and you kind of find out if you're too high, it gets too intense, and you can back it down a little bit. But the ultimate is when you go back for the sleep study, like 30 days after it's been activated and everything, which, by the way, my score was a 5. I was normal.
5 or below is normal,
Yes,
correct?
I was normal.
And you were up to
I was
how many
43.
episodes?
I was normal. So anyway, in the lab then, when they're doing the sleep study, then they're able to really fine tune it. And the patient does have the ability to increase this or decrease this, if you feel like you need to. I really pretty much leave it on the same level all the time.
Now, Peggy said it was a game changer and she's feeling great and she's sleeping through the night. Is that your experience now?
Yes, let me tell you something. About 2 years ago, this is after 1 full year of using Inspire, my cardiologist and my electrophysiologist removed I don't use a blood thinner anymore. I was off my arrhythmias. I have not had any other, I get maybe a slight palpitation once in a blue moon. My life has dramatically changed. And I could tell you the underlying cause for my sleep apnea, a lot of it was the arrhythmias in my case. That's been really arrested and calmed down.
Do you still snore?
Yes, my wife.
In that 15, 20-minute period.
In that first initial 15, 20-minute period?
Where the tongue starts working.
And you go, oh, it's working now. And what do you think of Inspire?
I think it's wonderful. I sleep 6 to 7 hours a night with this. I wake up in the morning. I'm like, I don't have any headaches. I'm clear-minded. We drove to Charlotte about a month ago, and I drove straight through. We stopped for lunch and whatever, but I would have never been able to do that in the past, just out of sheer exhaustion. So my everyday life has really improved. I can watch the hockey game like last night and not fall asleep and miss a period and a half.
You can go to the movies and not fall asleep?
Absolutely.
Yeah, okay.
Just overall, and my overall health has just improved dramatically. I'm in a really good place.
Okay, I just asked Dr. Halil about the Peggy's experience. Is her experience was typical? Is his experience typical?
Very much so. This is what we like to see. This is what we like to hear. And I tell you now, the Inspire has been in use for maybe 6 years or so, and enough data has accumulated and enough experience has accumulated for us to be able to say that first, it works, and second, the effect of it is sustained over a long period of time.
Okay, let's see if this is working. There we go. Okay, we had some questions over here. All right, do you have a question for either David or Dr. Halil?
I have several, but what was the definition of that arrhythmic? I forget exactly the term he used.
Atrial fibrillation.
Yes.
It's an irregular heartbeat where your heart speeds up quite a bit, let's say to, in my case, 100, 150 beats a minute, and it's very erratic. And what happens is that your heart now is working overtime, and it's very inefficient, and it causes a lot of fatigue and everything. I can feel it. It's not a good thing.
Dr. Halil, what causes the heart to race?
Well, these are problems with the conduction of the impulse inside the heart that goes haywire, basically. And the heart, instead of it beating with a regular rhythm, all of a sudden the rhythm is erratic, as David was saying, and it goes fast. And the other really significant problem that occurs from that is that it can lead to formation of clots in the heart and strokes.
Well, a lot of times, in layman terms, basically, when you're sleeping, you're choking. And your body is shooting some adrenaline, and it makes your heart beat faster, and then it wakes you up, and then you try to go back to sleep, and that whole rhythm goes, it's circular. It just keeps going. Is that basically what happens? Do you have another question?
One for right now would be what the blood thinner that you were using, and how did it allow you to stop using a blood thinner?
My doctor evaluated all of the data he had on me as far as my improved sleep apnea and my overall health and everything, and determined that I did not need it anymore. and he's one of the top electrophysiologists at Allegheny General.
All right, we have another question.
To the doctor, how are the three components connected? Are they hardwired or remote or?
Hardwired.
So then the one in the tongue, does that mean a wire goes down your throat, or is it under the skin, or how's that?
No, it's on the nerve. It's implanted on the nerve in your neck, and then it's hardwired under the skin to the battery. And then from the battery, there's another wire that goes to the sensor that's between the ribs.
David, can you feel it right now?
I can feel the device. It's pretty close to the skin. If anyone's had a pacemaker, it's about the same type of feeling. So after a while, you don't even notice it's there.
Okay. You have a question?
First of all, when you wake up in the morning, do you still feel the device working, that you will turn it off and not walk out of the house without it not being turned off?
In my case, I notice that it's working, so all I do when I wake up is turn the device off. It does have like a 9-hour window, so if I forget, it eventually will shut itself off.
Now, how long does the battery last?
When I was in this last time, it's good for over 10 years.
Okay, so at some point you may have to have another operation. Is that how it works?
Correct.
Okay. Do you have another you have a question?
That was pretty much my question, is what was the maintenance on the device after it's implanted, and what is the longevity of the device? Would it ever?
Yeah, do you have to continue to go to the doctor?
Yeah, I see the doctor once a year, and they do an evaluation and everything to make sure you're using it, and how many, they could tell how many hours a week you're using it, and then through some surveys and everything determine, how your life is, so that they want to make sure you're not having any other issues that could contribute.
Doctor, I have a question. I've had 5 what were called TIAs between 90 and 93. I'm on 2 different aspirin. I'm on high blood pressure water pills and things like that. My memory's terrible. So what do you think? Would this be a possibility down the road for me?
Have you had a sleep study?
About 10 years ago.
And what did it show?
They showed everything was fine by their measurements. I had it at Mercy Hospital.
Well, I mean, of course, not every arrhythmia comes from sleep apnea, but as we said before, a lot of these conditions can be associated with sleep apnea, and you just have to rule it out, because if there is sleep apnea, that definitely will need to be corrected, and correcting the sleep apnea will go a long way towards reversing these conditions, whether it's blood pressure or arrhythmia or...
Should I have another study done at a different hospital, or should I
do you snore?
Oh, yeah.
Then by all means repeat the study.
Okay.
What kind of advancements have they had in sleep studies?
Well, the standard is still doing the sleep study in a sleep laboratory, where, as David was saying, you get wired and so on. Sometimes this can be a little bit cumbersome, a little bit difficult, because it's unnatural. People are hooked up to wires and all sorts of things, and they find it hard to sleep. And sometimes it may need to be repeated over a couple of nights so that people get used to the setup. But more often than not, people can go through the sleep study fairly easy. But now also sleep studies can be done at home, and you can have the sleep study scheduled at home in your own environment, which is hopefully easier for you to fall asleep in.
Now it's a device that it's almost like a headband, correct?
Yeah, I mean you still need the monitoring of your heart rate, your oxygen levels, etc. Your breathing, your obstruction, and so on.
All right, we got a question back here.
Call me overly conservative, but when I hear implants, it worries me, because I wonder, is this going to change my lifestyle? Like your physical activity, is there things you have to watch out for, or that you maybe shouldn't undertake with these implants?
The only restriction with the implant is that you cannot have an MRI of your chest because there's an implant, there's a battery here. You can have an MRI of your head or of the extremities, but you can get a CAT scan of your chest, but not an MRI. Otherwise, no real restrictions.
What about a TSA scan? Can you go through the airport, David?
Yes, I have no issues as long as you don't linger in the screening.
Nobody can linger, David. It's TSA.
I know.
You're not allowed to linger at the airport.
So no issues.
All right. Anybody else have what's your question?
If the device doesn't work for you, is it removable?
Yes, it is removable.
All right. Oh, I'm sorry. I stepped on a toe.
What comes first, the chicken or the egg? Like, I hear you talking about an evaluation as far as whether your tongue is appropriate for where it rests to get the implant, and you get pre-authorization from your insurance to do that.
What is the process? I mean, first you need a diagnosis, correct?
Yeah, the sleep endoscopy is a test, and that is, and you have to do the test to be able to determine whether the patient is a proper candidate for the procedure. And that test is covered by insurance. But when it comes to the procedure itself and the implant, theoretically, it is FDA approved and is now becoming a more and more common procedure. But as you heard on the TV clip there, it is covered on a case-by-case basis. They don't give you a blanket coverage. Every patient has to go through the proper evaluation and the proper authorization. And it generally takes about 3 months to finish this authorization approval.
This is Geraldine from Inspire. I've got a question about insurance. I'm sure you've faced this a lot. So what is the steps?
So we do a prior authorization on every patient. So regardless of what your insurance is, you will know ahead of time what your copay is and what any other ancillary payments are. Medicare, Aetna, the Blues have policies already written, so those are a little bit easier to get through. But we do a prior authorization, so there's no surprises throughout the process. You have a contact at the reimbursement desk that can walk you through every step of the process as we move forward.
Okay. Anybody else have any other questions? Oh, yeah, the hands are shooting up now. Okay. Hi.
So, what is the recovery time? How long does it take? And like, if you have a job, how long will you be out?
The procedure itself is done under general anesthetic, so the patient is asleep. Takes about an hour and a half to do. And then there's recovery, and then the patient goes home. It's an outpatient procedure. Usually there isn't a whole lot of pain or discomfort after this. I don't know if your experience was different.
I had very minimal pain. I was pretty much back to normal within a week or so. Checked in with a doctor. They just check all the incisions just to make sure everything's right. But mine was pretty quick, and it was easy in my case. I sailed right through it.
Hi, I have 4 questions.
Oh, good. All right, good.
Okay, so you're not cut all the way from here to here. You're like cut here and the little electrode is shoved, right?
Yeah, there are 3 incisions.
Okay.
Each one of them is about 2 inches.
Okay, next question. Do you have to take antibiotics like if you go to the dentist because this thing is a foreign object? You know how when you get your
Well, we
teeth-
generally give antibiotics before the procedure.
No, I mean if you go to the dentist. If you have like a knee implant, they make you take antibiotics because you could get bacteria down in your...
Oh, you mean afterwards?
Yeah, like a prophylactic.
Probably a good idea. If
Okay.
you have to have, let's say, dental work.
Okay, so if you're going to take a nap, because you tend to nap for a couple hours, do you turn this baby on when you nap?
I hate to tell you, I don't nap anymore.
Okay.
But you could turn it on. If you're going to sleep more than an hour or so, you can turn it on and take a quick nap. But my days of napping are over. I don't need them.
Okay, last question. I get headaches and migraines, and the doctor gives me muscle relaxers, so I sleep all through the night now. Is that good for my muscle in my throat? Do I still have sleep apnea now that I'm sleeping all through the night with a muscle relaxer?
Are you having symptoms of sleep apnea during the day?
Yes.
Are you having
Yes, I'm very
fatigue and
tired.
somnolence? And
So is it bad to be relaxing this muscle that's
not
relaxed?
necessarily. I mean, if you need the muscle relaxant, you need the muscle relaxant. But if you are having sleep apnea on top of that, I think that will need to be checked out.
Okay, thank you very much.
You're welcome.
keeping me busy. Okay.
We had considered this Inspire a few years ago. We had heard about it on an advertisement, and my concern was, from a long-term perspective, do we know any risks that might be involved in implanting such a device into the body?
Again, so far the experience has been about 6 years with several hundred patients who have had this procedure. The satisfaction with the device has been really great. And David is a good example, and he's not an exception; he's the rule. And this, even the study of these patients over the period of the 5 or 6 years has been consistent. The effect does not fall off, it does not fade or go away, and there haven't been problems with the electrode or the implant or the sensor. Geraldine probably would know more about long-term follow-up.
Long-term follow-up, it's the same neuromod device that we use in other neuromodulation technologies, which has been out for 27 plus years with no long-term effects whatsoever. There's no dysphagia or negative effects on the nerve.
And also, as of last month, I understand that there are over 4,000 people in the United States that now have had the procedure. I was number 50 in Pittsburgh and number 500 nationally back 3 years ago.
On the articles on the website, it says the BMI needs to be 32 or below. How strictly is that adhered to?
The BMI itself is not a critical measurement. The more important thing is what the degree of sleep apnea is.
Okay.
Hi. I have, I guess, a question for each of you. When you said that you really weren't back to yourself for about a week, were you off work for a week, or that was just intermittent follow-ups post-surgery?
I wasn't back to my. I'm told I was completely normal. You know, I mean, it took a couple of days just to, you know, you're a little bit sore and whatever, and then, so, I was saying, yeah, maybe a week, but not even. I mean, I could have gone back to work immediately. I was actually retired at the time, so, but if I had to go back to work, I could have gone back probably in 2 days.
The one thing we tell patients not to do after the implant procedure is, especially people who have to do a lot of physical work with their arms, their hands. We like their arm. Actually, we even give them a sling to hold their arm close to their body so that there isn't a lot of motion around the implant, around the battery. For a few days to a week, you know, we don't want a lot of motion, but after that,
you can
do whatever you
work
want.
out, you can go for walks, you can enjoy
Do
life
whatever you
as you always wanted to. It's completely normal now.
Yes.
Yes.
Okay. Geraldine, do you have anything else you want to add? If somebody wants more information on Inspire, where can they go?
www.inspiresleep.com, or you can see Aaron and I outside.
All right. Any other questions? Oh, yeah. No. Okay.
Will you excuse my poor language, but I had that machine, the first one at UPMC, like insurance, and I hate it. I hate it. It's about, I'm using it since 3 months, no more. And
You're talking about the CPAP?
The first one, yeah, this machine. Oh, yeah, and I hate it. And I'm
You're not the
coming
only
here-
one.
I'm coming because you know, because I hate it. I coming here today. If I want to have this this Inspire, what first step I have to do, like where I have to go, and is it covered after they pay to me for this machine? Will they pay me for this?
Again, the thing that will need to be done is you need to see your doctor and you need to have a sleep study. Once you have the sleep study and if the conditions are appropriate, then it can go from there.
So if you,
I have to sleep study again.
And if it's been if it's been within the past 5 years, you don't need to have another one.
It is not maybe 5 years. No, I have sleep study like since 4 months or.
Yeah, that's fine.
Yeah, so it was moderate. I think it's mild. It was mild.
All right.
Yeah. So if it is mild, can I have this Inspire?
Again, we can check it out and see if you are the proper candidate for that.
So where I have to go first of all, because.
The best thing is go to your primary care doctor, and then they can refer you to whoever.
So if there's forms in your envelopes, if you're interested in having the consult or you want to know the next steps, fill out the paper that's in the folder. Yeah.
Come see us after.
Yeah, I'll help you.
Come see us afterwards. We'll help you step by step. She'll even help you with insurance. Okay, so if you have questions about insurance, anybody saw a hand over here? Okay. You're way on the other side. You've fallen asleep. You must have sleep apnea. Okay. All right. What's your question?
You mentioned the sleep study, but then you also mentioned the endoscopy.
Yes.
So you have to have both of those, right?
Right.
Yeah, it's a bit of a process. There's a lot of things that aren't revealed. You have to go to a sleep study, and then you have to do another sleep study, and then you have to have this test, and then it can be a process. Am I correct?
Well, when you want to go through with this, you want to make sure that this is the proper thing for you, that you're the right candidate for this, and this is why we want to make sure that the conditions of sleep apnea are there, that the level of sleep apnea is the right level, whether the configuration of the throat and the anatomy of the throat is such that.
And CPAP is the first line of defense.
Still CPAP is the first line of treatment.
Okay. Question number 5.
Can I just ask this patient, can you show how far your tongue comes out when you do it?
It's Gene Simmons. Come on.
No, you probably won't even. I'll do it.
Okay. Little demonstration. Now, when you turn it on, it gives a pulse.
What I'm going to do. See, right now, this inner light is white, so I know it's off. There's 2 little AAA batteries back here. You're going to have to watch my tongue. I don't think you're going to even see it, okay?
So the remote turned green. It's just enough that allows air to pass through.
Just on the first one, okay? But it depends on where you are, I think, in your sleep cycle also. But when you're sleeping, you don't even feel it. You don't even know what's going on.
Tongue or anything.
And they monitor that. They look at where the tongue hits the teeth and everything, okay? So I may have been exaggerating a little tiny bit there, okay? But basically, it just hits the back of the tongue. It moves it very gently, then it goes back. Then about 5 or 6 seconds later, it starts again, goes back, starts again, goes back. But what it does, it gives me a continuous airwave so that I can sleep and I can dream again and I can get a deep sleep.
It's Party Tricks with David Edelstein. Nice. Okay.
I would also add one other thing here. The impulse not only pushes the tongue forward, but it also stiffens the tongue. So the tongue becomes harder and it moves forward. So it's instead of the tongue being relaxed and flabby, it becomes just like when you tense up your muscles, and then you move it forward.
Do you feel a tickle or anything like that would cause you to cough constantly or anything?
Not at all.
Okay.
All right. Any other questions? All right. If anybody has questions about, okay, hang on. Disc jockeys aren't used to working this hard. There you go.
In terms of the ranges, what you said 5 or less is normal. How does it progress from there? What's moderate? What's extreme?
5 to 15 is moderate, and then above 15 is severe.
Anybody with severe? Quite a few. How many episodes have you experienced?
My study was so long ago, I can't remember, but excuse me. The woman who took my test said it was the worst she's ever seen. And she was in it about 10 years.
Now, if somebody has anybody had the CPAP for longer than, say, 10 years? A handful. How has CPAP and other technology advanced in the last decade?
Well, basically, the CPAP technology is it. I mean, there are different types of masks and different types of devices that you can wear on your face or on your nose. Some people don't tolerate the full mask. Some people you go with the nasal pillows and so on.
But Inspire is basically as advanced as.
But Inspire is the most recent, most advanced thing that we have now for sleep apnea.
Any other questions?
In terms of if you have a sinus drainage problem, which I do have, which gets accelerated at night, how does that interact with this?
As long as there's no actual obstruction, if there is any blockage to the nose and so on, that becomes an issue. But if the nose is otherwise patent and open, then it's okay.
I have a lot of sinus infections, and I end up seeing the doctor a lot, and mostly it happens in the fall. Would this be affected by this, or will it have any?
Well, I mean, if you have, let's say, allergies that cause swelling and drainage in your nose and throat, that will still need to be treated. That can contribute to sleep apnea in a certain way, and can also affect the ability to use the CPAP. But it will not affect using the Inspire device.
Okay, any additional questions? Okay, hang on.
So my husband's sleep deficit is significant, therefore my sleep deficit is significant. And one of my concerns is he's a police officer and he works shifts. So obviously, number one, very dangerous job. I want to make sure he's as alert as he can be. Are there any considerations that we need to consider going through the candidacy process if they have irregular sleep patterns where he's sleeping during the day versus sleeping at night?
No, I mean, when there is sleep and sleep apnea, this is what this is for. No matter what what time he sleeps and so on. And of course, the sleeping shifts, and that adds a little wrinkle to the sleep apnea. If the sleep pattern is irregular, that can itself cause a problem for the adequacy of sleep and the rest that one can get from sleep if the diurnal rhythm is always changing. But if there is, the main thing is if there is an obstructive problem that is causing the throat to collapse during sleep, no matter what time you sleep, then this is the treatment for that.
Okay, any other questions? Okay, I want to thank you from the bottom of my heart for coming and signing up for this. How about a big round of applause for our panel, David Edelstein and Dr. Halil, Allegheny Health Network. If anybody has any questions or if you want to sign up for anything, Geraldine's here with Inspire. If you need more information, just go to the website, inspiresleep.com, inspiresleep.com. We've got Cook Goose Catering, providing food afterwards. So again, thank you so much for participating with this. This has been fun. Thank you very much.